Are you struggling with your weight? Do the same old exercises not work? You may struggle with your body image, which we all have for many years. Healing that relationship is an essential part of your weight loss journey. You might need to get back to your intermittent fast diet. This video. Is alternate day fasting right for you? We'll give you the easy steps to take to lose weight faster.
If you've been reading articles about the benefits of fasting, you may have already heard about the potential benefits of alternate day fasting. For example, this diet can reduce insulin levels and improve the body's ability to use insulin. And the best part is, it can even prevent the onset of diabetes. Watch this video to discover more about the benefits of alternate day fasting and whether it could be right for you. Then, take the first step toward achieving your fasting goals. This video will give you the easy steps to take to lose weight faster. A new study shows that alternate day fasting can significantly reduce metabolic rate. The researchers also found that the fasting pattern causes mild side effects, like reduced bone mineral density. But the fasting period is generally safe for healthy individuals. For those not in shape or pregnant, alternate day fasting may not be the best solution. Continue watching this video to learn more about the effects of alternate day fasting. Studies of animals and cells showed that alternate day fasting increases autophagy. This process may slow aging and prevent diseases. The term adaptive thermogenesis is used in metabolic research. The main benefit of this mode is that it drastically reduces the number of calories burned and can halt weight loss. While alternate day fasting does reduce metabolic rate, it doesn't seem to reduce it by a significant amount. The same study showed that an 8-week alternate day fasting program had similar effects as a standard calorie restriction plan. In contrast, alternate day fasting had an insignificant 1% decrease in resting metabolic rate.
The alternate day fasting is a method of dieting in which participants limit their calorie intake on fasting days to 25% of their daily requirements. It is not superior to calorie restriction on any other day, but studies have shown that it may be safe and effective for many people. The calorie restriction on fasting days is also temporary, with a cycle of days of ad libitum consumption. The effect of fasting is mediated by reducing the number of calories consumed during meals. Fasting increases postprandial and resting energy expenditure. The metabolic changes experienced during alternate day fasting are associated with an improved lifespan. Moreover, fasting has improved immune system function and decreased inflammation. This diet may be beneficial for preventing many metabolic diseases. Fasting can also be effective for patients with cardiovascular disorders, as it reduces the risk of many conditions.
A recent study found that an intermittent fasting regimen, or CIR, can decrease insulin levels significantly. This intervention has various benefits for the body, including reduced blood sugar levels, increased insulin sensitivity, and decreased inflammation. However, a few drawbacks remain. For example, the program can be counterproductive if it increases blood glucose levels, which can increase the risk of diabetes. In this study, participants consumed a standardized liquid breakfast for 3 hours before the intervention. During the intervention, they were also asked to refrain from exercise, alcohol, and coffee. Blood samples were stored at -80 degrees Celsius. Plasma lipids and glucose concentrations were measured using Roche Diagnostics enzymatic kits. Plasma glucose and insulin were also measured in duplicate. A glucose oxidase test was also performed to detect changes in the blood glucose level.
Studies have shown that intermittent fasting improves heart health and blood vessel health. The practice of fasting for 2 weeks 3 times a week significantly reduced total cholesterol levels, bad LDL cholesterol, and triglycerides. It also lowered systolic blood pressure. But what's the exact mechanism behind improved heart health? Researchers haven't found a definitive answer yet, but they suggest that it's likely to have some heart health benefits. In a study presented at the American Heart Association Virtual Scientific Sessions Conference, researchers found that intermittent fasting decreased cardiovascular risk factors in humans. The lead researcher speculated that fasting increased levels of the cytokine galectin 3, which controls inflammation. The results were significant enough to warrant a large study involving humans. But, if other individuals can adopt this approach, it could prove to be a promising intervention for people suffering from chronic conditions like hypertension.
The alternate day fasting, or intermittent fasting, reduces testosterone levels in men by 30%. The process also lowers blood sugar and improves insulin sensitivity. Higher blood sugar levels are a common metabolic syndrome symptom in men with low testosterone. Low testosterone may also cause a higher risk of metabolic disorders such as diabetes. But the exact mechanism of these changes is not yet known. The research on alternate day fasting is promising for this diet plan's health and weight loss benefits. Researchers studied 60 healthy volunteers for 2 weeks, reducing their caloric intake by up to 37% and fasting for the rest of the day. This method can result in significant weight loss, as participants reduce their calorie intake by about 7.7 pounds and their body mass index by almost 3%. One study compared alternate day fasting to calorie restriction daily to determine whether this diet can increase the body's ability to lose weight. The study also examined cardiovascular disease risk markers, blood pressure, and triglyceride levels. Although the results of the alternate day fasting group were promising, the study also found no statistically significant difference between the alternate day fasting group and the daily calorie restriction group.